friends, welcome to Smile Nursing tutorial. Today we are going to discuss about the estimation of hemoglobin by using SAHLIS hemoglobinometer. Keep all necessary items ready: SAHLIS HB meter, N/10 HCl, gloves, spirit, swabs, lancet, distilled water and dropper. Puncture proof container, 0.5% chlorine solution. Cleans the HB tube and pipette. Wash hands and wear gloves. Fill the HB tube with N/10 HCl up to 2 gram with the dropper and places it in the HB meter. Clean the tip of the person's ring finger with the spirit swab. Prick the finger with the lancet and discards first drop of blood. Allow a large blood drop to form on the fingertip and sucks it with the pipette up to 20 cm mark. Takes care that air entry is prevented while sucking the blood. Wipe tip of the pipette and transfer the blood to the HB tube containing N/10 HCl. Rinse the pipette 2 to 3 times with N/10 HCl. Leave the solution in HB tube for 10 minutes. After 10 minutes, dilute the acid by adding distilled water drop by drop and mix it with a stirrer. Next, note down the reading when the color of the solution exactly matches that of the comparators on both sides of the HB meter. Rinse the HB tube 2 to 3 times with N/10 HCl and disposes of the used lancet in puncture-proof container. Drop the used gloves in 0.5% chlorine solution. Thank you for watching this video. If you like, share, subscribe and comments.